Good day, viewers and listeners. I'm Manara Khan, and on today's COVID 19 update, Minister of Health Honorable Dr. Frank Anthony tells us that from tomorrow, persons who've had their Sputnik V vaccine in April and May can now get their second dose.
We've had discussions with the Guyana Cricket Board, the Ministry of Culture, Youth and Sports, the National Task Force on COVID 19, and um, we've also received guidance from the International Cricket Council and the WICB. And in all of those discussions, we're looking at how we can host these matches successfully, as well as to have a balance in getting maybe some patrons or some fans uh, who would like to attend these matches. And so we have decided that we're going to do a couple of things to make sure that people are safe. The first one is to make sure that those who would be attending the matches are fully vaccinated. What do we mean by fully vaccinated? Fully vaccinated means that you have had both doses of your vaccine, and after the second dose, 2 weeks would have elapsed. So, which means that you would have adequate antibodies in your system to protect you against COVID. The task force, along with the cricket board, would have visited the stadium, mapped out a pathway for any potential fan that would be coming, at what point they would be stopped, checked, and so forth. So there's a very elaborate process that a fan coming to watch these matches would have to go through. In terms of when you come to the stadium, you're required to show proof that you have been vaccinated, which would mean that you have to produce your vaccination card. And to verify that you are that person, you will also have to produce your ID card. So even if you have a ticket and you don't have your vaccination card to prove that you're fully vaccinated, you would not be allowed into the stadium. So there will be persons there from the task force who will be verifying this. In addition to that, the gates would be open quite early so as to prevent people from congregating. There would be multiple places by entry, so to speak, so that we would minimize congestion. In addition to that, there are no concession stands, meaning that no beverages would be sold, no food would be sold, because at these events, people tend to go to these concessionary stands and to buy food and drink, and so that would not be allowed. And at all times during the games, from entering to going into the stands, you would be required to wear mask. And as you're seated on the stand itself, there would be the seating arrangements is not that people would be together, but they'll have alternate seating. So that's some of the arrangements that have been put in place. And apart from those, we'll have health and medical personnel um, at the stadium, and those persons are normally there whenever you have a match. So those persons, if there are any injuries or so forth, they'll be on hand to render assistance. So we have personnel from the Ministry of Health. We will have personnel from the CDC who would also be there, and these persons would help to guarantee the safety of people from a health perspective. The government of Guyana, we have been having discussions about changing our entry regulations, and that meaning persons traveling into Guyana or passing through Guyana. And more recently, we are guided by some decisions that have been taken by CARICOM, where at that level, uh, there have been two principal things that most countries in CARICOM would now require. One is that a traveler must produce a negative PCR, and secondly, they must also produce proof of vaccination. So we are moving to honor that decision that CARICOM has instituted, and you will see some changes as we go forward, and that would be for all travelers coming to Guyana. So I think more explicit um, travel instructions would be forthcoming in the next few days. We know a lot of persons who took their first dose, and some of them are now becoming eligible for their second dose. And as you would recall, second dose is anytime between 4 weeks to 12 weeks. Initially, we were using the minimum period of that 4 weeks, but then we were advised that we can go to a maximum of 12 weeks. That is what most countries are now using. We have been following that protocol. So those persons, as of last week, as you would recall, we had started giving the second dose to those persons who got their first dose in April. We'll continue that process from tomorrow, and anybody remaining from April will be able to access their second dose Sputnik, and then we move on to those persons in June. So as of tomorrow, those who would be eligible for their second dose Sputnik will be persons from April and May rather. As of yesterday, we have had 246,716 persons receiving their first dose vaccine. That would be approximately 50.7% of our adult population. And again, we have had 130,429 persons who have received their second dose vaccine, which would be approximately 26.8% of our adult population. No, the mask that we have, you're able to inhale and exhale properly. The way that these masks are constructed allow for both inhalation and exhalation. So I don't think that's a problem. You have three main types of masks that are being used. The cloth mask, I think people can breathe quite easily through them because the pores in the fabric would allow for easy breathing. The procedural or surgical masks, they're 3-layered, and again, they allow for both breathing in and breathing out. And similarly with the N95, there are about 5 layers there, and again, they allow people to breathe in properly and breathe out. So there shouldn't be any threat that persons who use them and use them for long periods, that they would suffer any consequences not getting enough oxygen or retaining too much carbon dioxide.
This has been our COVID-19 update. For more information, visit health.gov.gy or dpi.gov.gy and our social media platforms.